Menopause is having a moment. Every woman at some point will experience this stage in life. It comes with a drastic drop in hormones, and that can cause hot flashes and brain fog and sweats.
Yeah, but treatment for these symptoms are not often talked about. Some say not even at the doctor's office.
Delia Gonsalves shows us how some women are taking a controversial approach to finding relief.
Some women are turning to testosterone pellets for menopause relief. Now, these pellets are not FDA approved. But before I tell you how it works and why women are doing it, let's go back to 2002. That's when the Women's Health Initiative blew up the idea of hormone replacement therapy, or HRT. You see, at the time, doctors were treating menopausal women with a combination of two hormones, estrogen and progestin, and it worked for a lot of women. And then along came this study, which said if you took these hormones, you were more likely to get a heart attack, breast cancer, or a stroke. And that scared a ton of women and their doctors. So hormone replacement therapy came to a screeching halt. Doctors stopped prescribing it. Even medical schools stopped teaching it. And that's when this woman, Dr. Melinda Hall, said she stepped in when others stepped out.
There are plenty of OBGYNs, but very few choose to even prescribe hormones, whether they're FDA approved or not.
Dr. Hall runs the Menopause Center out of Vienna, Virginia, where she gives women these testosterone pellets. Now, I know what you might be thinking, only men have testosterone. We do too, just at much lower levels. And the doctor says during menopause, all our hormone levels drop, including testosterone.
I'm 52 years old, and I have to tell you, I feel like I'm 25.
That's Melissa Checco. She's been getting the pellets a little over a year.
I was feeling rough, very rough. I was very irritable, very anxious, hot flashes. After my second pellet, I have to tell you that hot flashes went away, the sleeping was better, the anxiety was gone.
Testosterone pellets come in a bottle like this. The pellet itself is tiny, like a grain of rice.
Now I load in the pellet.
A doctor injects it under the skin, right on the top part of your butt.
No hot tubs or pools for 5 days.
The pellet slowly dissolves and releases testosterone into the system for the next 3 to 4 months. Dr. Hall says she tests a woman's levels before injecting the pellet so she knows just how much or little they need. Critics say you can't really trust the hormone levels written on this label because testosterone pellets are not FDA approved or regulated. So what if a doctor gives you way more testosterone than your body actually needs? I'll let Dr. Catherine Marco from GW Hospital explain the worst case scenario.
The most common side effect we see is acne, okay? We also can see voice deepening. We can see hair loss, almost like male pattern hair loss. We can see clitoral enlargement.
So bottom line, do your research, weigh the risks and benefits of any hormone treatment to relieve your menopause symptoms. But you should know these testosterone pellets are not covered by insurance. The procedure alone costs $500. Delia Gonsalves, WUSA 9.